Hello, everyone, and welcome. We're just giving it a few moments for everyone to get connected to their audio. So thank you for joining us. We'll begin shortly. Hello, everyone, and welcome to our ISPCAN Monthly Journal Club. ISPCAN's monthly international journal clubs are always free of charge and cover diverse research topics, which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help you, our members and partners in the ISPCAN community, gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes for children globally. Today, we'll be focusing on the special issue journal, Learning in the Context of Adversity. Tips for making the most of today's session. Please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We will begin the open Q&A session immediately at the conclusion of the presentations. And please take a moment to introduce yourself to other attendees, our moderators, and our featured presenters in the chat box. Let us know where you are joining us from, your organization, and your discipline. To enhance your experience, you may choose to enable closed captioning from your Zoom control bar by choosing Captions. And as always, for joining us today, a recording of this session, the panel discussion, presentation slides, and links to featured resources will be sent to you directly in a follow-up email after the webinar. We will also be engaging in an interactive Slido polling. So please have your cell phones ready to scan the Slido barcodes to participate in our online polling. And our key learning objectives for today's session: to describe a framework that outlines transactional processes in a trauma-informed learning environment, to identify ways in which adversity impacts student learning, to discuss potential mechanisms that can mitigate or promote learning resiliency, and to discuss how to engage in cross-disciplinary collaborations to build academic resiliency and support for adversity at the community level. And now I'd like to introduce you to our presenters. Dr. Shanta Dubey. Dr. Dubey is professor and director of the MPH program at the Levine College of Health Sciences at Wingate University. Shanta received an MPH in epidemiology from the George Washington University and a PhD in behavioral health from the University of Georgia's College of Public Health. In 1999, she joined the CDC as a preventative medicine fellow and served as one of the early investigators on the landmark CDC Kaiser ACEs study, leading to CDC awards for scientific excellence and international recognition. Since 2014, she has led and engaged in various global initiatives related to ACEs science, trauma-informed care, and substance use disorders. Dr. Dubey serves as the advisory board member for the Child Advocacy Center of North Carolina and serves as associate editor for the Child Abuse and Neglect, the International Journal. And Dr. Carlo Paniglio. Dr. Paniglio is an associate professor in the Department of Educational Psychology, Counseling, and Special Education, and a faculty member with the Child Maltreatment Solutions Network at Pennsylvania State University. He received his PhD in Human Development from the University of Maryland with a specialization in developmental science, along with a certificate in measurement and statistics. His program of research focuses on the dynamic interplay between development and learning for children who experience early adversity, and how the understanding of such processes can inform trauma-informed classroom instruction and prevention efforts. And also joining us today are our distinguished panelists. They'll be joining for an interactive panel discussion at the conclusion of the presentations. These include Dr. Lisa Shelby. Dr. Shelby is an associate professor at Florida State University College of Social Work and a faculty affiliate at Florida Institute for Child Welfare. She serves as a director of the Child Wellbeing Research Network at the University of Kentucky College of Social Work. Lisa is co-editor-in-chief of the Child and Adolescent Social Work Journal. Specifically, her research examines the experience of young people aging out of foster care. She is interested in research dissemination and the formation of research policy practice partnerships. Also joining us, Dr. Christy Terrell-Corbin. Dr. Terrell-Corbin is a clinical professor of human development at the University of Maryland, and executive director of the Center for Early Childhood Education and Intervention, and the co-director of the Trauma-Sensitive Pedagogic Project. Her early work in foster care and adoption in New York City laid the foundation for her career as a researcher, where she focuses on young children at risk due to adversity, specifically in low-resource communities. And Dr. Catherine Kaur. Dr. Kaur is an associate professor of special education, curriculum, and instruction in the College of Education at the University of Illinois. Her research focuses on young children with disabilities who've experienced or are at risk for trauma and the formal and informal service delivery systems in which they participate. The long-term goal of her research is to make high-quality early childhood special education services accessible for all young children with disabilities and their families. Welcome to all our presenters and panelists. We are honored to have you. And at this point, I'd like to turn it over to Dr. Dubey.
Good morning, good afternoon, good evening, from wherever you're coming from today. Thank you, Jane, for that wonderful introduction. And I will tell you, it's an absolute honor to be presenting with my colleagues today on this webinar. And thank you all for making the time to join. We're hoping that this will be fully a learning experience for all of you. And I really highly want to emphasize that our goal today is to provide information to you around learning in the context of adversity and to also learn from all of you. So I'm looking forward to discussions today. I always present this slide. It just reminds me of the work that I've been engaged in for the last 25 years, and I hope it will connect for you too as well. When I approach a child, he inspires in me two sentiments: tenderness for what he is and respect for what he may become. This is a quote by Louis Pasteur, and as many of you know, Louis Pasteur was instrumental in germ theory and helping us to really, if you will, prevent infectious diseases. But I think this quote really speaks to all the work we are engaging in early life and early childhood development. So I don't want to spend too much time on this slide, as Jane provided this. These are the 4 learning objectives. However, I did want to highlight my presentation today is going to focus on 1 and 2, really to discuss about how we engage in cross-disciplinary collaborations to build academic resiliency and support for adversity at a community level, and also to kind of touch on and identify ways in which adversity impacts student learning. And then Dr. Panlilio is going to jump into 3 and 4 and do the deeper dive. In 2018, I actually guest edited a separate issue entitled Highlighting Education and Learning in the Context of Childhood Abuse, Neglect, and Related Stressors. The only reason I bring this up is because this was, if you will, the stepping stone or the springboard for Dr. Catherine Kaur and Dr. Carlo Panlilio and I to guest edit the issue that just came out in August, for which this journal club is focused on. But what I want to highlight is this particular issue kind of just, if you will, touched the surface. Some of the article, but it was a hearty issue. But the reason I say that is because this issue that we just published in August goes deeper. But some of the articles we published, for example, focused on educational neglect. So looking at the educational neglect as a form of maltreatment. Also understanding how trauma impacts academic aspirations of foster youth. And then another study examined resiliency in the academic setting. These were all wonderful studies and really helped to address some of the gaps. And we're hoping today, by learning from the second issue or the other issue that we published in August, you'll understand a little bit more around how to promote resiliency and understand the mechanisms around that. So I'm going to stop here and invite you to join this Slido. You can use your phones and do the QR code, or you can go to slido.com. But the question I'd love for all of you to answer so that we have a better understanding is, are you currently working in an educational setting within your region, country? So it's a yes, no answer. So I invite you all to participate. All right, we're looking at about 50-50. 54-46, 60-40. Of course, it always changes. The more people that respond, it's going to keep fluctuating. Give another few seconds for folks to respond. So if you're not working in education, I would love to invite you to, in the chat, please provide the discipline that you are working in. I'm going to go ahead and move on. So as I mentioned, one of the learning objectives is to really understand the various disciplines that are engaged in understanding adversity in the context of learning. And my field is public health. So I am a social and behavioral epidemiologist. I've been studying ACEs and the impact of ACEs on health for about 25 years. But as a social and behavioral epidemiologist, we can't overlook how education plays into this. So when I think about public health is essentially the study of communities, and it's focused on population health. So our patient is not at an individual level. Our patient is a community or population. And so when we think about education, we think about education as a setting, and the individuals within that educational setting are the community. When we also talk about public health, it's important to understand our three core functions. They are assessment, policy development, and assurance. And within those three core functions are these 10 essential services. So this is what my discipline and profession focuses on. And you see a lot of epidemiologists kind of working in the assessment piece, but we also utilize assessments to understand the needs of our community. So when we think about the education system, when we look at assessment, we're really trying to understand what are the needs of not only the students, but of the faculty and staff that work with the students. Then we go into policy development, thinking about how we communicate, how we educate, how we can strengthen and mobilize partnerships. And then assurance really allows us to ensure, if you will, that we are carrying out with due diligence our policies, our programs, our education, so that they're reaching everyone. And that's why equity is at the center of our core functions and essential services. Furthermore, I think it's important for me to point out that both World Health Organization and US Healthy People 2030 have an objective to, if you will, strengthen the public health infrastructure. And what would that look like? Its key components focus on training and training a capable and qualified workforce, having up-to-date data and information systems, and then agencies capable of assessing and responding to public health needs. And I guess you're probably wondering, what does this have to do with education? And we're going to get into that in the next few slides. But first, let's touch on what is education. So education, as I've kind of defined it here, are three pieces. Education, that overarching term that speaks to the schools, including universities, again, that setting. And it's also the process of giving and receiving instruction in a systematic manner. When we talk about teaching and training, we're thinking about the instructors. These are the methods and individuals who pass knowledge or transfer knowledge to others. And then learning. This is one I want to really focus on. Learning can equate to the student or the learner. And it's actually the process by which we all acquire knowledge and skills. So I consider myself a lifelong learner, and learning is a very key component because it is how we acquire knowledge and skills. But more so, learning is actually, if you will, in behavioral change, a way that we transition from, risk behaviors to health promoting behaviors. As many of you are coming from around the world, I wanted to highlight the Child Wellbeing Index. And in particular, these are the various indices that make up child well-being. So there's material, that's about deprivation. It's the basic needs, if you will, for early childhood development, health and safety, including, healthy birthing, maternal child health, and as well as immunization, family and peer relationships, behavior and risks. And then there's also subjective well-being that's included in this index. But I wanted to highlight education as one of the key components of the Child Wellbeing Index. And World Health Organization also talks about the non-medical factors that influence health. We are all probably familiar with what are social determinants of health. But again, I want to highlight that education, along with income, social protection, unemployment, job security, if the material determinants, education is a key determinant of health. And this is where we start to get into the nexus, if you will, the combination of education and public health. So as a social epidemiologist and somebody who's analyzed lots of different data, education is a leading social determinant of health. We have conducted epidemiologic studies for decades. In this, we've studied morbidity, mortality, poor quality of life, high burden of behavioral risks, especially among persons with less than a high school education. But most of these epidemiological studies examine the data, social determinant of health amongst adults. So when we think about education and the formative years, we really need to think upstream. And I'm not, if you will, criticizing our epi studies. They're very important because they provide important information. But what I'm highlighting is the data is collected amongst adults. So let me highlight some of the studies that have come out. This is a study from CDC examining, for example, smoking, which is still a leading cause of disease and death worldwide. And in the US, individuals who do not receive a high school diploma can go for a general equivalency degree. And those are, if you will, put together into the variable, they're combined. But in this graph, what I want to highlight is, yes, overall, all of these groups have decreased in their smoking. But if you look at the absolute differences or absolute risk, the gray line, no high school or GED, remains higher than the other three lines. Similarly, there was a study to examine the relationship between, again, US adults with less than high school education and adverse childhood experiences. And this graph shows that indeed, those adults with 3 or more ACEs, 33.1% of them had less than a high school education versus 22.3% of adults with 3 or more ACEs having more than a high school education. Again, highlighting the importance of the nexus of education and health. And more clearly here, we're showing how adverse childhood experiences or events are associated with where adults are with their educational attainment. So if I could sum this up in one way, if we think about childhood exposure, and these are adversities, abuse, neglect, parental separation, divorce, substance abuse in the home, mental illness in the home, being in foster care, these are some of the adversities or adverse childhood experiences. However, there are many other traumatic exposures, and we're going to talk about that with our panel today. These can lead to, if you will, some of the sub-indices of education. I don't want to get into too many details because Dr. Panlilio is going to go into this, but this includes, for example, social emotional development, as we saw, educational attainment, engagement with learning and curriculum, and engagement with the school's social environment. So let's talk about stress real quick. There are 3 types of stress as we know it. And let me just tell you, learning itself without anything else is a stressor. So all of you right now, as you're experiencing this webinar, might be having a little bit of stress because you have to focus, you have to concentrate, you have to listen, you might be taking notes, and that's normal. So we talk about positive stress as that brief increase in heart rate, mild elevations in stress hormone levels. In fact, if you ever took a Physics 101 course, you would learn that most systems do not function without a little stressor applied. So that is what we talk about with positive. Tolerable is a little more serious. It's a little bit more temporary stress responses that are elevated for a longer period. However, the key piece around tolerable stress is it's buffered by supportive relationships. So if we go back to learning, yeah, we have that test, but if we have a nice group of study buddies, we are buffered with supportive relationships. Toxic stress, however, is prolonged activation of stress response in systems. And it's the absence of supportive, nurturing, and positive or protective relationships. It is the constant ding, ding, ding that occurs, and with no relief in sight. And that is what we want to really address, mitigate, and prevent, especially in learning environments. Lastly, when we think about toxic stress, it impacts the developing child that we can't really readily see, and that's through the endogenous toxic stress response. Cortisol, catecholamines, their constant release is associated with impacts to the developing brain, specifically the hippocampal and amygdala. So how does this manifest health-related? Well, this is what we see in adolescence, early initiation of smoking. There have been studies to show that adversity leads to vaping, illicit drug use, early alcohol use, early sexual debuts, suicidality, and teen pregnancies. And then in the education system, the studies over the last couple of decades have really shown, and we showed in the 2018 special issue that it increases absenteeism, trouble concentrating, behavioral difficulties, suspensions, withdrawals. And I drew this arrow to both of the health-related and educational and justice-related. And the reason is because they're indicators of each other. So if a student is having problems or missing school because of smoking, they're experiencing absenteeism. Or if they're, having anxiety, they may be engaging in drug use. So there is a relationship between the two, and we don't want to silo these. And that's why there's a lot of nexus between health and education. I love this graph because it shows exactly what's happening developmentally to the brain before birth, after birth, and then in the formative years. I always draw attention to the yellow because what we know is that our sensory pathways begin developing in utero. In fact, at 6 to 7 months in utero and during pregnancy, the unborn fetus can actually hear the outside world. And that peaks during that first year. So imagine they're just taking in so much information. They're learning. Their brains are making many different connections. So here's another pictorial of neural connections at birth, 6 years and 14 years. So we know from 0 to 3 years, there's like rapid synapses production. It really peaks between 3 and 10 years. But then by adolescence, there's a process known as shedding or pruning. And what that is, those neural connections that are constantly nurtured are stay, but those that are not go away. So this is very important to understand from a resiliency perspective. What are the positive childhood experiences that can help promote kids and their learning and their well-being? But here's what else we knew. During my time growing up, I was always told the brain stopped growing and stopped developing at like 18 or 20. But we know that there is brain plasticity and learning can occur through adulthood. And that's important when you think about adults who work with kids, their own trauma that they may have experienced and how that might trigger them in school settings. So education, as I mentioned, social determinant of health, but it is malleable. What do I mean by that? We can change it. I mean, we can continue to learn. In the studies of trauma survivors that I've been engaged in, education and learning has been associated with healing and recovery. And the target populations we really need to think about. So again, I'm a public health person, so I'm thinking of setting and populations. Who are we targeting? Staff and teachers, the adults, all students, but particularly students with learning disabilities and students who have experienced or are in foster care in that system. We really have to think about, globally, we have to think about moving from this school to prison pipeline to a restorative approach. And the only way we're going to get to this is by understanding the role that adversity has in learning and understanding the importance of resiliency. This is the upstream approach. The upstream in public health is preventing people falling into the river and drowning so we don't have to pull them out downstream. So when we think about abuse, neglect, and related trauma, we really want to think about preventing or mitigating at least midstream. State legislation in the US has really expanded. And I wanted to share this recent study by Crowley et al. They document in the US between 1999, so that was a few years after the ACE study was launched, to 2019, 43 states and the District of Columbia have introduced bills referencing ACEs. Many of these I encourage you to read this paper, but many of them include laws that address childhood trauma, childhood adversity, toxic stress, or ACEs specifically, and they address cross sectors. So education, healthcare, child welfare, law enforcement. And I share with you This is going to launch, and I trust you all can see this because I practiced it several times. This is a picture of the United States and the number of bills introduced. There are still several states that don't have bills introduced, but there are many states that have at least 57 bills with language around ACEs. And what I want to also draw your attention to is this timeline. So this is about, well, almost, let's see, 1999, sorry, 15 years into the ACE study. And 2012 is when the US American Academy of Pediatrics released their policy on toxic stress. And then in 2014, the US Substance Abuse Mental Health Services Administration released their trauma-informed framework. And so both of which were informed by the ACEs science. So you can see these were bills introduced, and these are the ones that have actually been enacted. A lot has happened in the US, but a lot more work is needed. So as I mentioned, the Trauma-Informed Care Behavioral Health Services released in 2014, which has really driven a lot of the work in the educational system. I will tell you in my own analyses of legislation, the one thing myself and my student found is that across the sectors, education has been the most proactive with ACEs in the US. Healthcare is catching up, child welfare is pretty close to education, and law enforcement is now really catching up. But I believe we have a lot more work ahead of us. So I'm going to end with this slide. We really want to increase the awareness, acceptance, and adoption of ACEs science, particularly in the educational systems, since education is a social determinant of health. It's going to require that macro policy level, but we have to do a deeper dive to understand the mechanisms at the educational level. We want to foster learning environments that are safe, supportive, and nurturing. We want to promote community resiliency, especially in the learning environment. And to do this, we need to study the mechanisms of adverse and positive experiences in the learning environment. This is the last Slido, and I invite you to take part. I'd like to request to provide 1 to 2 words if you're in the educational system, or even if you're not. What are the greatest challenges faced with student learning in your particular geographic regions? And if I'd like to invite you to do that now, it will create a word cloud, and we can kind of see what everybody is experiencing in their respective areas. I hope you can see this slide. Okay. I guess, okay. So poverty seems to be the primary. Frustrations, lack of support, funding of programs, school funding, low resources, limited school funding, absences, anxiety, high teacher turnover rate, teacher burnout, vicarious trauma. We're going to talk about that. Tolerance to violence. Corporal punishment, overcrowding, housing and poverty, dropout. Conflict. Thank you so much for your sharing these words with us. I'm going to stop here and turn this over to Dr. Panlilio, who is now really going to help us understand just what needs to happen in the educational learning systems.
Thank you, Dr. Dubey. I hope everyone can hear me okay. Thank you for setting up the stage and helping us understand how important it is to really take a deeper dive into learning and understanding of what happens, especially from a public health perspective. And I'm hoping that what everyone is realizing is that trauma and adversity is really complex, and that we do need a cross-disciplinary approach to begin to understand this. And as Dr. Dubey has mentioned, a lot of the social determinants of health related to education is of particular importance for children with adverse histories, so that we can ensure trajectory of success as kids get older. At the same time, Dr. Dubey has highlighted a lot of the US efforts at the policy level, at the macro level from a public health perspective. And hopefully some of you are asking, what or how do we then translate some of these policy macro level efforts to something that is more feasible and manageable at the micro level? And this is the impetus for our conversations, to look at this from different levels. And I want to invite everyone to begin to think about addressing adversity, especially in schools, not as an either or, is it a macro or is it a micro approach, but really together. And I think by working together, especially across disciplines, across silos, across systems, that we are able to then begin to help the families and the children that are experiencing a lot of these challenges. So just as a reminder, this was the educational index that Dr. Dubey mentioned, with some of the sub-indices that are of particular importance, that include a physical environment in the school that is helpful for kids to begin to learn, school enrollment, as well as their attainment, literacy, how well they learn in the classroom, which are indicated by some of these learning outcomes. And so, as mentioned by Dr. Dubey, these adverse experiences leave a mark, particularly on kids' development, especially across some of these sub-indices of educational attainment. And so some of these include, for example, looking at decreased school attendance, as well as the impact of adversity on grade level standards that are typically below average. So we see this across domains of math, reading, as well as writing. We see decreased attendance and engagement for students who have experienced maltreatment specifically, or adversity more broadly, as well as an increased likelihood of grade repetition and decreased likelihood of graduation. And as you saw in Dr. Dubey's graph, oftentimes with lack of graduation or GED attainment, that there is a higher likelihood of kids then increasing some of the challenges later on. So the question now is, how do we go beyond learning outcomes to be able to understand some of these learning processes that can especially inform prevention and intervention efforts in the classroom? And so for this, we need to be able to turn towards a science of learning perspective. Here, what we'll understand is that the advancement of fundamental knowledge, especially about learning for children and adults, because learning is, as Dr. Dubey mentioned, a lifelong endeavor, especially when we think about this within the context of adversity, requires a transdisciplinary approach, so that we can consider specific challenges that we face in education specifically, and across systems broadly, as we try to implement trauma-informed practices, especially as we attempt to translate this from research to policy and practice. A science of learning perspective can allow us to understand how trauma-informed education should consider both the student and the teacher as active learners as they embark on this journey of learning and instruction concurrently, especially within the context of adversity. And so what I want to do before we move forward is to have some definitions that ground us in at least a unified description. And so I wanted to define learning from a science of learning perspective as the acquisition and modification of knowledge, beliefs, attitudes, strategies, emotions, and behaviors that often result in enduring changes, especially due to different experiences. These could be considered experience-dependent developmental processes, wherein the context may vary, but it allows us to either have a richer experience to learn, more efficiently and effectively, or lack of cognitive stimulation that leads to otherwise. And so these experience-dependent processes actually lead us to variability in development and learning trajectories over time. In other words, learning, broadly speaking, should involve change, should endure over time, and relies on experiences that allow us to then learn from it and change some of these domains. If we think about adverse experiences, this is a particular contextual experience that we have seen impact academic outcomes. These are historically what has been looked at in studies, and as Dr. Dubé's prior special issue shows, the nexus of health and education, there is an important element to understanding how in particular adverse experiences impact educational outcomes. And so this has been often the focus of inquiry and is an important aspect of this. Again, not to diminish any of the contributions of a lot of these studies. Again, it is not an either or, but an and. And so what do we do next from here? And so this is where we need to examine what happens to these learning-related cognitive and neurophysiological processes because of adversity. And as Dr. Dubé have touched on already, we can see, for example, that when we respond to environmental stress, our body's stress response systems may either exhibit one of the following: positive stress tolerant burst stress, or toxic stress response. And where I want to sort of highlight this important interaction is that with the prolonged experience of toxic stress, what we see is that children's limbic hypothalamic pituitary adrenal axis, or HPA axis, becomes overactive and releases a lot of cortisol, or the stress response hormones. And as mentioned already, a lot of this has an impact on children's developing brains, especially when adversities have been experienced early on in life. And we see this happening, for example, in the amygdala. And so what studies have shown is that there are substantial volume reductions in the amygdala, and this results in an amplified attention to threat. And so what that means is lower amygdala volume and perceived threat increases the attention, and coupled with other networks that impact children's ability to inhibit responses and then shift, becomes problematic if you think about this, in particular within a classroom setting. We also see, especially volume reduction in the anterior cingulate cortex. And oftentimes this results in problems with error monitoring. So couple that with an amplified attention to threat. You hear something, you look over, you perceive it to be threat, and you're having problems with error monitoring, not realizing that, oh, it's actually just a stimulus that is distracting and not really a threat. It's harder, again, for kids to then disengage from that perceived threat. We also see that volume reduction in the ACC, or anterior cingulate cortex, results in problems with emotional identification as well as processing. And as it pertains to a lot of learning-related processes, decreased working memory. What this means is that with decreased working memory capacity, children's ability to actually engage in higher level cognitive processing as they are reading, for example, increases in cognitive load makes it harder to engage in more complex learning related processes. So with reading, for example, if the text becomes too difficult, couple that with problems with comprehension monitoring, it becomes harder for children to recognize that it is harder for them to take a step back, reflect on the strategy they're using, whether or not they are able to actually develop a coherence model, which means that they're developing a mental representation of the text they are reading and able to actually comprehend and understand. With decreased working memory, that means with some fluency problems that kids who are reading may have a harder time actually moving forward with integrating a lot of the text, because they are slowing down, trying to understand each word, each letter sound more in a more effortful capacity rather than having it occur automatically. We'll see this in math, for example, where if you are calculating, right, you will need to actually have to work through some of the problems, making use of working memory, bringing back what you know about the problem from your long-term memory storage, working on how do I approach this problem, and then getting that into a feedback loop. So we'll see a lot of these neural impact on a lot of these cognitive processes that are important for learning. And I think one of the areas that has received a lot of attention really is the prefrontal cortex in the frontal region. Here we see a lot more problems with higher order cognitive processes that are related to executive functions. We see, for example, decreased inhibitory control in children. We see, for example, problems with attentional shifting, with planning. And so a lot of times what we'll typically see is that children who have experienced adversity, there may be a higher prevalence of being diagnosed with attention deficit hyperactivity disorder, especially with the inattention type, because of some of these executive function challenges. In the context of schools, you'll see how decreased inhibitory problems as well as attentional shifting may be a challenge for students, especially as they have to wait for their turn to be able to inhibit distractibility. But one of the things that is important here, especially as it relates to one of the articles in the special issue, is diminished reward processing. And what this means is that children's approach to what they perceive as rewarding experiences or rewarding stimuli may be less than ideal. And so we will see this potentially impact children's motivation, especially as it pertains to academic tasks. So this is important because, as I mentioned, these neurophysiological processes are related to a lot of these cognitive processes for learning that includes motivation, comprehension monitoring, emotional regulation, engagement, as we want to see children engage in the classroom and the schools, that impact children's learning. So one of the ways that actually we can begin to understand the mediating mechanism that impacts children's learning towards these challenges and outcomes that we've noticed is to look at, for example, from a developmental science perspective, how adversity impacts self-regulation. Self-regulation from a developmental science standpoint is defined as the volitional management of attention and arousal, including stress physiology, as we've talked about earlier, and emotional arousal for the purpose of goal-directed action. And so my conceptualization of this is a dual process model that is bidirectional and interactive, looking at bottom-up automatic processes that's related to stress physiology, emotional arousal, and reactivity, with top-down processes that are more active, volitional processes, such as executive functions that help us direct attention, organize our cognitive resources, and regulate our emotions in order to be able to achieve a goal. And so one of the things that I've noticed, especially as we try to understand how or why children's early experiences of adversity have impacted their school performance, is that the neurophysiology can directly link to most of these self-regulatory processes of bottom-up automatic reactive processes as this interacts with top-down executive functions. And it makes sense when we think about adversity typically resulting in more adaptive responses in children. And so what we see here oftentimes are protective adaptive responses in an adverse environment. And we see this in congruence when children go into the schools, in the classrooms, where the adaptive responses are no longer serving a function in a classroom setting, assuming that the classroom setting is safe and supportive. And so it really is about us understanding that most of these reactive responses aren't done in malice. Instead, that these are really adaptive in nature, and that it allows us, hopefully, to understand that it's about replacing some of these strategies that are incongruent in classrooms with those that might be more purposeful for learning. The other thing that I wanted to mention is a self-regulation perspective that brings in the neurophysiology and to understand the adaptive nature of adversity can actually be integrated with the perspective of a self-regulated learning model that is drawn from the science of learning. And so here, you'll see a lot of overlap with self-regulation, but we see a lot more of the cognitive processes here, where self-regulated learning consists of proactive and dynamic processes where learners, and so this model is specific to learners, whether they be children or adults who are helping children in these systems, where learners systematically orient toward learning goals that involves self-oriented feedback to select and employ strategies that allow us to monitor, regulate, and control our thoughts, our emotions, and our behavior toward the acquisition of these social as well as academic skills. And it consists of three interrelated phases. The first is forethought and planning, which are processes that we engage in prior to learning and related activities. So here, as a learner, we need to be able to develop a goal that allows us to mobilize our resources before we proceed. This means that we need to be aware. And so metacognitive processes are important in this case so that we have an understanding of the learning task analysis in this case. How hard is the task? How easy is the task? What's the context in which the task is that we have to complete it? And then, do we have the strategies, the necessary strategies or procedures to complete that task? So a lot of this happens before we even engage in the process. And so metacognitive awareness in this case includes our capacity as learners to understand what resources we have to complete this. We also need to be able to understand our own motivational beliefs, such as self-efficacy, meaning, can I do this? Our confidence in completing a task, as well as our perceived task value. So is the task something that fits within our overall goal or enjoyment that would allow us to then step on the gas, so to speak, and move forward? And this is where we see a lot of goal setting and motivational beliefs as then perhaps incongruent with some of what we'll see for students who have experienced adversity, given the need for protection of their emotional security. Next is the performance and monitoring stage, which occurs during the learning task itself, where learners then engage in more volitional processes required to attain the learning goal. Here we see, for example, learners engaging in strategies to address a task. So if we are, let's say, completing a math test, we need to know what our prior knowledge is, what strategies we will require to complete a task. So if you have an algebraic equation, you need to understand your order of operation, for example, and what strategies we would select to complete that task. We also need to be able to engage in more effortful and persistent activities. Even if the test is hard, can we sit there with the discomfort and continue and persevere through it? Which means that we have to be able to effortfully shift our attention as we are actually engaging in that task. We also need to be able to look at ourselves and engage in metacognitive monitoring to see how effective are some of these strategies, how consistent are the goals with what we're doing to pursue this, and be able to shift as needed. This is then followed by the reaction and reflection and performance stage that occurs at the end of the learning-related activity, where we reflect on our performance to be able to understand what worked, what didn't work, and how do we then proceed with the next activity that may be related. And so here, being able to attribute causes to, let's say, effort as part of success is important for us to consider, because then this influences choice and where students and learners move on next. And so if I, for example, feel that I am less efficacious with STEM-related courses, this might mean that my next selection of courses will be less related to STEM. On the other hand, if I feel more efficacious, I have the strategies to succeed in science, technology, or engineering or math courses, I might select more STEM-related courses moving forward. And so we can see that these interdependent cycles are important as kids pursue their learning objectives. So this leads us to how do we create a trauma-informed learning environment, especially as we integrate both self-regulation and self-regulated learning And what we see is an integration of different disciplines to understand how these processes actually mediate what we've already seen here in Path 1, which is early adversity influencing later academic outcomes. And so looking at this, for example, we can understand where in this SRL, or self-regulated learning, and SR, or self-regulation cycle, children begin to feel more challenged. This allows us in a trauma-informed or adversity-informed learning context to be able to understand when it is that we can intervene or prevent some of these problems. So if we understand the impact of adversity on self-regulated learning, we can implement prevention strategies. Here we see it as Path 4A, to make sure that children, that we prevent any SRL or SR challenges for those who have SRL challenges, being in a more sensitive and adversity-informed learning environment or trauma-informed learning environment, where we can provide support and responsive instruction. We might be able to mitigate some of those SR and SRL challenges so that children can actually succeed. And so this is the framework that we are proposing to allow us to understand where and how some of these processes are proceeding. And so the collection of papers in this special issue provide us with a burgeoning support for this conceptual framework. It allows us to understand how and why children who experience adversity might struggle academically, and more importantly, what can we do to support learning within this trauma-informed learning context. And so even though not everyone of the authors are here currently, I will try my best. Everyone did an awesome job with the writing, and I will do my best to represent people's excellent work. And so what we see here is looking, for example, at this link between early adversity and academic outcomes. Ferrara and colleagues looked at a systematic review of empirical studies, examining the relationship between maltreatment and reading outcomes to see what these processes are. We also see that Lynn and colleagues have looked at the impact of adversity on math skills in kindergarten. I think what is really important here is that these authors have looked at the long-term influence that even before the children were born, their parental trauma when their parents were younger actually have a long-term impact even on the next generation's mathematical abilities. Orr and colleagues proposed that we look at how intimate partner violence as a specific context of adversity has actually increased the likelihood of poor school attendance and suspension in Aboriginal and non-Aboriginal children in Western Australia. And so we see a lot of these impacts having long-lasting effects. And Gresham and Karatikin have looked at how some of these early adverse experiences actually have long-term impacts even outside of post-secondary across into college. And so what these 4 articles have shown us is that we need to look at other specific domains such as reading and math to be able to dig deeper into some of those processes, as well as looking further into the environment before children are born and after across post-secondary and beyond. When we look at the mediating role of self-regulation and self-regulated learning, we can see burgeoning evidence across each of these phases. Within task analysis, we see Sellen and Jackson looking at the association between adversity and non-word repetition tasks. So these tap into phonological processing skills such as encoding, phonological assembly, phonological memory. And so this is important, particularly for kids' reading abilities, because it shows us that prior knowledge or general knowledge related to word recognition is really important. And this could have implications for how children then engage in their orthographic systems for reading. Alvarado and colleagues have looked at grammatical abilities, not just traditional vocabulary measures, which have been looked at in maltreatment adversity studies. So what we see here is that not only our vocabulary skills challenged, but also that these integrate into more higher order problems with grammar. Altian has looked at adversity and its impact on reward processing, and this is important. As I mentioned earlier, we see, for example, prefrontal cortex functioning diminishing that then has an impact on reward processing that, when we see some of these small effect sizes for reward valuation and reward responsiveness, we might then see negative implications for kids' later task interest and value, especially as this relates to achievement motivation. Within the performance and monitoring phase, we see persistent problems with engagement. For example, out-of-home placement has been associated with challenges with truancy. We see that there are, however, protective factors when kids begin to think of school as a successful environment for themselves. And so they can then look at more resilience-related internal assets that may hopefully mitigate some of this truancy. McDonald and Bierman have looked at the importance of early childhood, especially preschool student-teacher relationships, as an important mediating mechanism for kids' later academic engagement, especially for those who've experienced adversity. And so what they've found is that kids who have had early adverse experiences, especially within the preschool period, have shown positive direct effects on their external behavior problems and negative direct effects on their student-teacher relationship by kindergarten and third grade. And so this shows us that the student-teacher relationship quality, especially in kindergarten, becomes an interesting point of intervention and prevention so that we can begin to shift developmental trajectories through the student-teacher relationship. And finally, in the reaction and reflection stage, we see from Lurie and colleagues that the role of growth mindset is important on academic achievement. If we begin to think of ourselves as focusing on our effort and that these achievement outcomes are really as a result of effort and that there's room for growth, we see more positive outcomes for kids versus those who have a fixed mindset that they think it's really related to their limited ability. We see higher internalizing challenges as well as lower achievement. And so this gives us an opportunity to understand where and when also we can perhaps intervene when we're looking at helping children reflect on their performance and understanding that trial and error is normative and that it really is about learning how to navigate through that. So what we see here is that there are burgeoning evidence in the self-regulated and self-regulated learning sphere. And so what we need to do then is understand how not only do we bring up individual resilience factors for kids, but really looking at the role of adversity-informed learning context to be able to actually make space for resilience as a more system-level response. So there's a need for us to understand and leverage kids' strengths within a supportive environment that can help us foster resilience and then promote academic success. And so to make space for resilience, it's important for us to acknowledge the multifinality of these developmental outcomes, even though there are similar initial risk and protective factors that we, within a trauma-informed or adversity-informed learning context, can help prevent some of the downstream consequences of adversity. And so a shift in perspective requires us to identify some of these proximal mechanisms through which we can then help promote some of these protective factors within children and then across the systems. And given that resilience really is a multi-systemic developmental process, we really need to understand the moderating role of adversity or trauma-informed learning context in our model here in particular, so that we can offer such proximal processes to prevent and intervene and promote resilience across the entire system. And so to address the learning needs of children who have experienced adversity, schools need to be transformed into trauma-informed systems that infuses and promotes trauma awareness, knowledge, and skills and policies that are guided by the following 10 essential elements that are outlined by the National Child Traumatic Stress Network. You can see, for example, being able to identify and assess traumatic stress is important. But what is key here is that most trauma-informed systems have attempted to engender a lot of these essential elements at the whole school level. And where we want to really help increase learning effectiveness for children is in number 5, where we create a trauma-informed learning environment by understanding some of these mechanisms outlined earlier to then inform our pedagogical strategies. And so what we see here with the remaining set of articles is how we can then proceed with an adversity learning environment. So Compton and colleagues here talked about defining and differentiating across terms that we often use to describe adversity. I don't know about you, but the field is fraught with many different terms such as adversity, trauma, ACEs, maltreatment. And I think being able to create a common language to help guide education, research, and practice in trauma-informed care is important. The authors also recommended a shift from a trauma-informed to really an adversity-informed practice. This allows us to specifically support the translation of childhood adversity into classroom pedagogical practice, especially through the science of learning, particularly when we think about adversity as also engendering some positive adaptations to adversity that may actually be capitalized on and recognized and help children succeed in the classrooms. And so this helps move us away from a deficit perspective to one that allows us to account for some of the resiliency in children. The authors also recommended that adversity-related screening in schools should move away from the use of the original ACE items, given that it fails to account for students' complex histories and the multifinality of the experiences of adversity, and the potential danger of further stigmatizing students. And instead, what schools should do is look at individual level screening that focuses on students' academics, mental health, and behavioral needs that result from the adversity. In other words, instead of looking at the event, let's look at the impact on the children. The adverse-related screenings, however, should occur at the group level or school-wide level. So that way we can look at extended adversity items that might be relevant to the school, such as peer victimization or community violence. This move from individual to school-wide screening will be better suited, especially when we think about in the US, the application of multi-tiered systems of support that inform the development and implementation of universal prevention efforts. And finally, professional development for educators should move beyond the declarative knowledge of ACEs to more reflective practices that encourage more questions about their practice and allow for more adversity-informed considerations that improve the student-teacher relationships for student achievement. And speaking of the sort of reflective practice and student-teacher, Dr. Dubé will talk a little bit more about her study and what her main findings are. So I will pass the mic on to Dr. Dubé.
I won't spend too much time on this because I want to make sure we have time for the panel, but just briefly, this was a training I was engaged in for 2 years with K through 12 teachers and staff. The focus was actually they were what we call trauma champions, representing each of their local educational districts, if you will, or agencies, as we call it in the US. And as adults, I employed, if you will, the transformational learning theory by Jack Mesereau. That was very critical in this particular training because these are adults rather than kids. And integrating the self-reflective practice and learning was also integral to help the teachers and the staff not only get the explicit knowledge about what are ACEs, how do you recognize ACEs in kids? What are the symptoms in kids? But understanding their own response and even reaction or triggers to situations that they experience in the classroom or with students. I'll allow you to read the paper, but there's some qualitative information based on their reflections, which really speak to realizing trauma's common, recognizing the symptoms, resisting re-traumatization, and also for them to understand their own response in this situation. So I won't spend too much time here, but it really speaks to the framework that Dr. Panlilio has outlined, but taking more of that multi-generational approach, working with the adults to get them prepared and ready with skills that are trauma-informed based.
Thank you, Dr. Dubé. We also have a paper by Dr. Terrell Corbin and Dr. Shelby, who are both here with us today, where they discuss the need to create cross-system collaboration that can hopefully break down disciplinary silos to build evidence-based policy and practice. In particular, this research, practice, policy, or RPP partnership strategy places a focus on the problem of practice defined similarly across systems that we can then begin to define it uniformly, explore solutions, and implement potential solutions, and engage in ongoing evaluation. This collaborative strategy is particularly important when we want to address teacher burnout and high turnover, as well as secondary traumatic stress that's associated with teachers having to balance increased curricular demands with increased expectation of using more trauma-informed pedagogy. Munger and colleagues looked at policy focus on issues surrounding the coordination of care and services, especially at the intersection of child welfare and early intervention, which allows the support for provider readiness and well-being, especially within trauma-informed systems. And finally, Lee looked at the protective factors that are associated with enrollment in formal center-based childcare, including Head Start and Early Head Start, and how enrollment is actually seen as a protective factor wherein kids begin to score higher on their cognitive and social emotional assessments, especially when they transition to kindergarten. So as you can see, a lot of these studies have so far addressed 5 of the 10 essential elements that include identifying and assessing traumatic stress, teaching trauma education and awareness, creating a trauma-informed learning environment, understanding and addressing staff self-care and secondary traumatic stress, and especially collaboration across systems and establishing community partnerships. And I'm glad that Dr. Terrell Corbin is here along with Dr. Shelby to speak about the collaboration, and Dr. Kaur is here to be able to help us understand, especially looking at the intersection of disability and welfare, and the importance of early intervention could be something that we could begin to discuss. So I thank you all for being here. I want us to turn over to our panel members, and just as a brief reminder, we have Drs. Kaur, Terrell Corbin, and Shelby here with us with their areas of expertise listed out. We have Dr. Kaur, areas of expertise in early childhood, disability, and trauma and maltreatment. Dr. Terrell Corbin in early childhood education, secondary traumatic stress, high poverty schools, school-university partnerships, and Dr. Lisa Shelby, whose areas of expertise focus on education of youth and foster care. Youth and foster care, especially in post-secondary education, which we saw is a long-term consequence, and research policy practice partnerships. So thank you all, and I will turn the mic over to everyone.
Thank you, Carlo, and welcome to our panel. We are so excited to have you here, especially with your levels of expertise and your specialties. We did have some questions come through that speak to those expertise. So I'd kind of like to start with the panel if we could, and then go to the other Q&A questions that came through. This one is for Christy. It says, why is it important for social service organizations, policymakers, and schools to work together to support children and families?
Thank you, Jane. I think this is a critically important question. And I was looking at Dr. Dubé's word cloud, and I think it was Holly who put it up. I was trying to screen capture and I wasn't quick enough, but I have it on my screen. And I think some of the key words there, certainly a key word was poverty and low resources, but you also spoke to the high teacher turnover rate. You talked about limited support for teachers, lack of support, frustrations. And I think what that speaks to is the importance of us working together. In the United States, we often use a phrase about breaking down your silos. We tend to work and do our work in our own space, and we don't work with others in other spaces. And I think we're at a point where it's critical that we work together. And I think the fact that the paper that we authored, I got to author with Lisa, who actually works in a school of social work. I work in a college of education. And our third author is a research director for Prevent Child Abuse America, which is a major organization here. And has an international arm, as you probably are well aware. So what we're trying to do is work together to reduce duplication, but I also think to be more proactive. I often use a phrase that when we work together, teachers can spend more time teaching and social workers can spend more time in proactive work with families versus reactive or punitive. But I also think we need policy members makers at the table, because they have the ability to increase funding, to change regulations and rules, etc. I could go on, but I will be happy to turn my time over to someone else right now. Thank you, Jane.
Jane, you're on.
Sorry,
Okay.
I'm sorry about that. I do have a follow-up just quickly, Dr. Corbin. How do you get policymakers to the table?
That's a great question. I think you have to develop relationships. I think as a researcher, one of the important things to get the attention of a policymaker is to have data. That data can be quantitative or it can be qualitative, but I think having data that you can bring to the table that you can share with them is important. Also, making a connection, finding an area that's of particular importance to them or on their agenda, or which they have introduced legislation, I think is another key way to get policymakers at the table. Bart, our colleague, often uses the term small p. It doesn't just have to be a very high level elected official. It could be a policymaker in terms of a school system superintendent, someone who oversees a school system. So I think there are a lot of ways to do it, but I think data and relationships are probably key.
Thank you. And Dr. Shelby, I have a question for you as well. I know you specialize in kids in out-of-home settings and foster care children. I'm just kind of curious if you put that expertise into this question. Like, what can be done to make sure that educators are adequately supported so they can facilitate learning in all students, including those who experience the adversity of out-of-home setting and foster care and broken homes? And
great question. So I think broadly we need to focus on educators' capacity to be able to teach. And this is a very personal issue for me. One of my sisters is a teacher, and what she finds is that there's so much going on in the classroom that it interferes with her ability to focus on teaching physics, because she's actually helping students navigate life and the challenges that they are experiencing, and some of them just developmentally appropriate. She's working with high schoolers and relationship development, but some of them very quite serious, as dealing with insecure housing, food instability, violence in the home. So when I think about how we prepare educators, it's making sure that they have the structure and support to deal with the issues, and that they are not having to simultaneously be a social worker and an educator. And I think that one of the ways that we do this is to listen to the educators and to make sure that we are answering the questions, we are providing the support that they need. And the work that I've done around making sure that we are using research policy practice partnerships, that we center the educators' experiences along with the learners. And so that we bring together the policymakers, the school administrators, we're bringing together the researchers, we're bringing together the teachers and the parents. And we're seeing this as a way that we're working together, and not just hoping that the teachers figure out how to help the young person who's in foster care, who's struggling. And when we think about adolescents in foster care, there's futures are pretty uncertain, and as well as often the instability in their present life, and that is a major obstacle to learning. So if we can make sure that the teachers have the resources to support those students, and that the students themselves are able to be heard, I think that it's the only option we have to be successful for education to truly occur.
thank you, Dr. Shelby. And Dr. Kaur, I know your specialty is dealing with kids with disability, which, as complicated as this entire session has made us realize, that you've highlighted the complexity for every student dealing with students with disabilities, nonverbal students. I mean, the complexity is tenfold. So I'm curious what you want to share in regards to the framework or the how you make how you overcome the adversity of the disability and whatever else that may lead to for these kids.
Yeah, thanks for that question, Jane. I think when I think about kids with disabilities, particularly in the context of the United States, there's been a lot of policy work, advocacy work to secure rights and freedoms in terms of seeking educational services, and that's been huge. So kind of circling back to the discussion around policy work that needs to happen. But beyond that, sort of piggybacking off of Dr. Shelby, is this idea of collaboration. So we have special educators who have disability expertise, who know how to support individuals with disabilities to be successful in educational settings, but they aren't always trained to understand the impacts of adversity. And so that becomes difficult sometimes. So I really see this as an opportunity for us to collaborate across systems, which has kind of been a theme here today, where special educators can bring disability awareness, understanding, and support to the table, while someone from child welfare might be able to bring knowledge around adversity, trauma, the impacts of abuse, and things like that. So children with disabilities aren't always at the forefront of the discussion, unfortunately. But I think because of good advocacy efforts and more and more interest in sort of supporting all children, that this particular group is one that's worthy of attention.
Thank you so much for sharing that and the great work you do in that area. So I'm going to the Q&A now. And so, Shanta, I think that whatever panelist feels like they want to take a stab at the question, and then obviously we'd love to hear different perspectives on the same question. One question is, during my research on institutionalized children, we were in the position to explain to me about the family difficulties that they were able to face with their parents, but they do not like to stay away from because of the difficulties. Sorry, I'm sorry if I said that incorrectly. So they face the measuring various adversities and contexts relating to their voices. What type of training is needed for adolescents? So I think specifically the challenge of institutionalized children and their ability to articulate their situation and how it affects their learning environment.
I'm happy to speak to that. I think that there's a need for support for young people who are in out-of-home care, who may be in an institution. And I'm not always convinced that is the responsibility of the educational system. But here's what I do know, going back to the common theme of the need for collaboration and coordination, that if there is any efforts that are being done in the social services to encourage adolescents to be able to articulate their needs and to deal with the really complex decisions. Do they disclose that they are in out-of-home care? Some of my ethnographic work, the young people took considerable efforts to hide the fact that they were in a foster home because they did not want to face the stigma or discrimination. So I think that any efforts that occur in the social services about how to prepare the adolescents, there needs to be a parallel process about how to make sure that the adults are creating the space so that the young people can be themselves and disclose information, and that it is an environment that teachers are not going to respond with, raised eyebrows, covering their mouths, like, "Oh my gosh, I didn't know you're in care." That there's the appropriate response, and that there's really a respect of privacy, confidentiality, and it doesn't interfere with the learning environment. So yes, information should be communicated with the young people, but we also need to make sure that all of our educators and staff are also prepared.
Perfect. Thank you, Dr. Shelby. There's a question about mental health as well. It's just a comment and a question. It said a lot of research has been done regarding mental health awareness for young adults and adults, but barely much in regards to children under age 10. And they have varied emotional situations, emotional duress, various reasons such as toxicity at home, bullying, school. How do we train the little ones to acknowledge and seek support in this regard?
I'll start because my area is early childhood. Catherine, jump in. I promise I'll defer to you. I think critically, one of the ways we start is we start with their teachers. I think having efforts that are focused on helping teachers to have awareness on trauma-informed practices, to understand the impact of toxic stress is critically important. As Catherine said, we oftentimes will prepare special educators to be extremely knowledgeable of disabilities, but we don't necessarily prepare them to have knowledge about trauma. I think the same is true in general education. So I think we need to focus on teachers, and our teachers need to be trauma informed, and they need to think about a project that Carlo and I had to pull from that is we have a project called trauma sensitive pedagogy. So it really is about teaching and learning, and how do you teach in a way that is sensitive to the child's traumatic experiences. So if those programs are not readily available in whatever country you're in, I think this is an opportunity to collaborate with social services or to collaborate with public health, where you can bring those individuals into your education system to work with your teachers so they expand their knowledge so they can indeed support the children. Dr. Kaur, what would you add to what I said? What did I leave out?
Oh, I think you did a great job. I think one of the things that I always share about early childhood is it's such a prime time to sort of work on social emotional learning. So kids are learning how to identify their own emotions. We're helping them sort of understand their own behavior. And so it's the perfect time for teachers and parents to be able to talk with kids and give them that language to sort of understand what's going on in their life. So I agree with Dr. Corbin that sort of teachers can be a great source of support for kids to sort of understand their emotions and to be able to start to understand how to describe when things are good or bad in their life. And I think that's a really important step.
Well, that brings us to the request that we hear so much. And thank you, Sophia, for your question. What tools are available to help teachers? And you shared some incredible research on the subject. And we have a lot of educators in our audience. So what specific tools are available that we know about to help teachers learn about brain and how trauma affects behavior in classroom and educational success? And what is out there, whether it's for, kids with disabilities or whether it's just teachers in general, helping kids in the classroom?
We're short on time, so I'll jump in and say that Carlo actually showed some slides from the Center for the Developing Child at Harvard University. They have a wonderful website that's filled with information that you should be able to access anywhere on the globe. It's the Center for the Developing Child. I'll go ahead and pop it in the chat.
Thank you so much.
I think that is an excellent question that may help motivate everyone to begin working together, because I think, the Center on the Developing Child is one great resource, but I think other than that, one that allows teachers to actually synthesize the information and translate it into practice is one that is not there. And this is one of the things that I think, I hope is a motivating factor for everyone to begin to work collaboratively together to build some of these. The other thing is, you're always more than welcome to reach out to all of us and, to be able to help in terms of trying to initiate some of these efforts. But I think there aren't as many, because as I mentioned in my presentation, declarative knowledge alone about what trauma is not enough. It's really about how we put that into practice. And I think that's harder.
Well, and that leads us to the next question. Could you please give any tips or takeaways to promote families to come out from risk of adversity for their children?
I think it's, oh, go ahead. I'm sorry.
No, please, absolutely.
Well, My first thought is helping adults to be educated about adversity, what it is, how it appears in kids, and to not be afraid of it. And that we also need to support the adults, because the adults themselves often weren't parented, and there is an intergenerational component. So it's about both. It's for me, it's always about a multi-generational approach, and really educating and helping and supporting both the adult parents and the children.
Shanta, can you speak to some of the programs that have been implemented to promote resiliency in learning?
There are several programs. California has been very progressive in their school systems. I think I want to maybe let Dr. Penlilio speak to this, but there are, I can't name them right now, but there are some in the school system in California. Dr. Penlilio, can you speak to that?
I was actually going to ask if we can hear more from our panel members, since I've been talking a lot.
I'm not able to speak directly to the point. And this is one of the limitations. A lot of my work right now is in higher education, and so I don't feel that that's as relevant to the context. But one of the things I will say is that I do feel that there is this desire and for more of the information, and really speaks to like why I believe that we need to make sure that we have the research policy practice partnerships, because researchers need to be answering the questions, and this is a question that's coming from the field, and this is where I think that a lot of researchers are failing, myself included, about being able to give the information that's needed.
And Lucine made a comment in chat, a comment/question, which I'm not sure that any of us have the expertise to answer, but it says, when adults often don't understand the experiences and reactions that impact their own behaviors in life, how do we expect children to understand their world?
Well, and it's not only about like how do we expect children, but some of the things that are going on are structural problems that are much greater than a parent having an epiphany and a service being offered to assist. When we think about the structural inequality, we think about some of the intergenerational problems that have been reinforced by our economic structure. There's not really easy, quick solutions.
There generally isn't to complex problems, right? I mean, I think but that does lead us to, Shanta, I believe you said this was the second in a series of special issues around this topic, with a pretty substantial time difference between the two special issues. But knowing this great research is out there, where do you see, this goes to all panel members, where do you see the next level of research happening? Or where do you see the opportunity to take research and data to action? I know the framework article that Dr. Penelio and Dr. Dubé wrote is a great substantive piece as well. But where do you see the next steps? Where do we take this research from here?
I'll just chime in really quickly. So in terms of next steps, some of the work that I'm trying to really engage in is around how do we build competency? So really, right now, I'll be honest, public health is robust, but I think we need more trauma-informed integration into our training and our curriculum. And I think that that's fair to say across various disciplines, including the health sciences and clinical. And I'm focusing on, that kind of upstream approach for future clinicians, PAs, OT, PT, MDs, and also educators. So I think that's a key piece. And I think really understanding how we can build some common competencies that can fit the disciplines would be ideal.
Perfect, thank you. And then starting at the youngest age possible. Again, I think the point was made that we tend to focus on adolescence when some of the learning and behavior issues become more extreme, but recognizing that trauma-informed educational practices need to happen at preschool. And
Yes.
certainly, kindergarten, first grade, second grade, like the earlier intervention, the more effective.
I will say that the early Head Start programs in the US have adopted, and actually, in fact, they promote adult self-reflective practice in their work with the 0 to 5 age children. So I have seen that bit of a shift with that particular program in the US. But I agree, we still need to, there's still a lot of work that has to be done, because to make a cultural shift, we all have to learn, and it has to become not declarative, as Dr. Penlilia says. It has to become part of our DNA almost. So we still have quite a bit to work on.
Well, this makes me think a little bit about how we create trauma-informed systems. So, for example, in many instances with really young children, birth to 3, if they experience child abuse and neglect, we sort of wait to see if they fall behind and then provide services. So a more trauma-informed approach would be, if a young child birth to 3 has experienced child abuse and neglect, they would automatically qualify for early intervention services. So that would be sort of a preventative step to sort of hook families up with services, because we know the statistics that these kids will likely later need the services. So that's a real difference in terms of the way we orient ourselves in terms of policy and funding, and move to sort of this preventative approach instead of sort of waiting back to kids show up in kindergarten or first, second, and third grade having difficulties. So it's not easy to do, but that's kind of an example of how we could think about it.
Perfect, thank you. Well, I know that we are at time. I do want to just, if there's any takeaways from our panelists, from Dr. Dubé or Dr. Penilio, any parting words that you would like to share? I hope that we got to most of the questions. I also encourage the audience. I know there's been a great sharing of resources. If you have any great resources around this topic that you have used in your practice or in your discipline, please feel free to put it in the chat as well. This is, as much as us helping each other in the audience as well, and supporting any great resources that are out there. So please feel free to post that, our audience members. And then Shanti, I know that you had a question about social media, and you posted something in the Q&A box. If you want to post that as well, the impacts of social media on the adversity and the learning environments. But again, to our presenters and panelists, are any parting words you'd like to share?
I think, Dr. Kaur said it nicely, which is to focus really on prevention. And I think that entails having really the collaboration across different systems. And if we focus a lot on some of those mechanisms of change, not just the distal outcomes, I think perhaps we can then begin to unpack why learners, both adults and children, might be struggling in schools. And so if we're able to develop these programs that would actually shift the needle, I think that would be something that is, worthwhile exploring.
Thank you.
I think a takeaway is to be cognizant of the fact that teachers and childcare providers are really on the front lines of our society and interact with children on a regular basis. And so I think that's important because, number one, they come to know a lot about individual children themselves. I think to Catherine's point about early preventive efforts are important, but I also think it speaks to the critical importance of those in the education system collaborating with those in the social services system and the public health system, et cetera, so that they are informed, They are a critical point of contact for children and also for families for resources. So I think the fact that we're all here together and we represent different disciplines is a really good sign and a good step forward. And I think that has to be the future.
I'll just end with, I echo that in terms of the multidisciplinary piece. I do really think we need to make this more mainstream than it is right now. But I also, I go back to my comment about the multi-gen approach. I mean, it is about the children, but honestly, to prevent it in the children, we really have to support and work with the adults. That is super duper important. And that is a focus of mine. And I think that, you know, once once we see that it's everybody, we can really begin to work on the problem in a more efficient way.
Thank you.
Yeah, I'll share that. I think a lot of this discussion has made me think about how taking a trauma-informed lens can help us strengthen the teacher education workforce. So to Dr. Shelby's point earlier, we lose a lot of teachers every year because they're stressed, because they're dealing with very difficult circumstances in the classroom. And so I think as we move to a more trauma-informed way to prepare teachers and to support teachers in the classroom, there's hope that they will have the supports they need to do this really difficult work and stay in the field long term. So I'm crossing my fingers that that is a potential way to strengthen our education workforce.
And my closing remark is that I walk away feeling optimistic. And when we think about how heavy trauma and adversity is, and that it's impacting our children and our educational systems and learning, it can be really discouraging. And yet I walk away from this not feeling disheartened, but rather optimistic that we have a knowledge base that's growing and we have the commitment. And it's incredibly exciting to me to see that across different countries that there is an excitement and interest in doing better. And so we're knowing better and we're doing that better. And that's exciting to me.
Thank you so much to all of you. I want to thank our audience for their level of engagement as well, for now the sharing of resources, all they do on a day in and day out basis, and thank them for being here. And I certainly want to thank our panelists and our presenters. The special issue was incredible. The link to that is on the ISPCAN website. We've been putting it in chat. I hope you take time to read the articles that were written by these great members today. And I just want to thank you for the great work you're doing. We know it's hard. Not only is the burnout and the trauma that the teachers feel, I'm sure you feel it as well with the research, with your areas of specialty. And, you know, secondary trauma is something that, you know, we feel strongly about supporting all of you with as well. So thank you for your time. Thank you for the great work that you do. Thank you for your commitment to kids, especially around this very important topic of education. And, you know, this sets kids up for success in life. So thank you. Just a reminder to the audience that we will send a recording of today's session. We'll send all of the presentation slides, the links to the journal article, and the special issue itself is already on the website, but we'll resend that link. And again, we just so appreciate you being here and the time and effort. So I hope everyone has a good day or night, depending on where you are. And again, please know that ISPCAN is here for you in any way we can. And you had over 70 countries represented today, over 25 disciplines. So again, Shanta, to your point about it being a collaborative effort across multiple disciplines and regions of the world to tackle this problem, I think today's audience is really representative of that. So thank you, everyone. Thank you for joining. Goodbye.